Welcome to a deep dive. Today, we're taking a bit of a shortcut to getting smart on something that affects all of us, the history of healthcare quality.
That's right. We're looking at the first 100 years or so, roughly 1860 to 1960. And what's really striking, is that modern healthcare quality wasn't some big planned thing.
Right, it wasn't a single blueprint.
Not at all. It sort of grew out of all these fragmented pieces, incidents, developments, things that didn't seem connected at the time.
So we'll unpack those key moments, find those surprising tipping points that really built the foundation for the standards you expect today. Where should we start? Florence Nightingale seems like the obvious place.
Absolutely. You have to start there. 1854, Crimean War. Her impact was just drastic.
How drastic are we talking?
Well, think about this. British troop mortality dropped from, 42.7%?
Wow.
Down to just 2.2%, and in only 6 months.
And that wasn't even complex medicine, right? It was basic.
Exactly. It was basic sanitation. Spacing beds out, proper ventilation, getting rid of waste properly, simple stuff, but revolutionary in effect.
So it was the practical changes, but also how she tracked it, the data.
Precisely. She wasn't just, nursing. She proved that collecting and, crucially, visualizing data was incredibly powerful.
Powerful how? To get funding.
Yes, to compel action to get money. Her coxcomb graph, basically an early pie chart, showed the brass exactly what was going on. It directly led to funding for hospital modernization.
So that was a real turning point for evidence-based improvements.
A huge one. And she was the first woman elected a fellow of the Statistical Society because of it.
Amazing. And that influence spread pretty quickly, didn't it, to the U.S.?
It did. Jump forward just 7 years, 1861, American Civil War. You have Clara Barton and the Sanitary Commission.
They picked up on those lessons from Crimea.
Very much so. They worked hard to improve conditions in the Union Army camps and hospitals.
Yeah.
And the need was just immense.
Right, because disease was rampant in those camps.
Unbelievably so. For every one soldier wounded in battle, 2 died from disease. So these sanitary efforts weren't just nice-to-haves. They were absolutely critical. It showed public health was vital.
Okay, so hygiene is one track. But understanding the cause of disease was another huge leap, right? Pasteur.
Exactly. Louis Pasteur's germ theory, that completely changed everything regarding antiseptic practices, how we even thought about infection.
And that understanding became critical later, like during the 1918 flea pandemic.
Oh, absolutely. A devastating pandemic killed 50 million people. And the Surgeon General, then Dr. Rupert Blue, he used some really visionary quality tools, even without antibiotics.
Like what?
Things like quarantine, mandatory medical exams for immigrants coming in, public health campaigns, trying to communicate what people should do. His records are actually still used today when planning for pandemics. Data, again.
That's incredible foresight. So public health is advancing, but what about technology for individual patients?
Technology was definitely moving too. You had Dr. Charles Chamberlain's early autoclave in 1879 for sterilizing instruments.
Crucial.
Very. And then Röntgen accidentally discovering X-rays in 1895. Imagine diagnostics before that.
Hard to picture.
But for hands-on care, maybe Dr. Peter Safar stands out. People call him the architect of intensive care.
What did he develop?
In 1956, the ABC technique for CPR. Airway, breathing, circulation, still a foundation today.
Right.
And he even worked with a toy maker to create the Resuscian doll for training people. Plus, he pioneered putting trained EMTs in properly equipped ambulances. A huge jump for emergency care.
So care itself is improving, but what about the people providing it? Medical education needed fixing too, apparently.
Oh, definitely. Abraham Flexner's 1910 report was a bombshell. It basically exposed American medical education as, a mess.
A mess? How?
Wildly inconsistent quality, schools with no real prerequisites, just way too many subpar operations.
So what did he propose?
Radical reforms. A standardized 4-year curriculum, strict admission requirements. It was a huge tipping point. Most medical schools actually closed. And it eventually led to the MCAT exam. It professionalized medical training.
Okay, better training, better tools. Then came the wonder drugs.
Right. You had crucial vaccines emerging, like for polio and diphtheria, transformative. But the penicillin story is just classic.
Sir Alexander Fleming.
Yeah, the sloppy scientist. Discovered it purely by accident in 1928. Just left a petri dish out.
Huh. An accident that changed the world.
Completely. Before penicillin, a simple cut, strep throat, those could easily kill you. It's hard for us to grasp now. But that's the world it transformed.
So medicine's changing, but how people paid for it was also shifting dramatically, wasn't it? Different countries, different models.
Very different paths. You had Germany under Bismarck starting state-run insurance way back in 1883. Then England after the war, with the Beveridge Report leading to the NHS in 48, free care for everyone.
And the U.S. took a different route.
Yeah, much more fragmented, tied to employment largely, like Henry Kaiser's system in 1945, which became Kaiser Permanente. These early choices about who pays and how really baked in different approaches to quality.
Do we see the impact of those early choices today?
I think you do. If you look at, say, recent WHO rankings for health systems, the UK was 18th, Germany 25th, the US 37th. Those founding philosophies had long-term consequences for quality and access.
Interesting. And it wasn't just medicine itself thinking about quality, right? You mentioned industry, Henry Ford.
Right. People often forget that quality improvement was also happening elsewhere. Ford's assembly line in 1908 wasn't just about speed. It was about efficiency, standardization, reducing errors.
Concepts we now call Six Sigma or lean.
Exactly. Those ideas, refined by companies like Toyota and GE, provided a whole framework for improving processes, cutting waste, ensuring safety. And those exact principles are now huge in healthcare quality improvement efforts.
So it really is this tapestry, isn't it? All these different threads weaving together.
It's quite incredible when you step back. A nurse's notes, accidental discoveries in labs, industrial efficiency. None planned to work together, but they form the basis of what we expect from healthcare quality now.
So looking back at this first century, what really jumps out to you, and what does it all mean for us listening today? Maybe the next time you interact with the healthcare system, you'll sort of see the ghosts of these pioneers in the background.
Yeah, maybe you'll recognize the echoes of Nightingale's data or Flexner's standards or even Ford's efficiency in how things are run. It's been a long, complex journey,